more important, don't watch the television, don't go to the doctor. Because in any way, they don't have anything which can help you. They don't have. If at all they have, you can tell me what they have which can help you. It can only make your situation worse. So let's try to understand that. Next slide, please. Now if you read this, cigarette, gutka, chemotherapy, radiation causes cancer. So the first two lines, first two words, gutka, cigarette, it looks to be familiar. Okay, gutka, cigarette causes cancer. We all know it. But chemotherapy, radiation causes cancer even more in comparison to गुटखा and cigarette. गुटखा सिगरेट से कैंसर होता है पता है, लेकिन उससे सबको कैंसर नहीं हो जाएगा गुटखा सिगरेट से, लेकिन कीमोथेरेपी रेडिएशन से सबको कैंसर हो जाता है. Chemotherapy and radiation do not cure the cancer. It is one of the most prominent cause of creating a cancer. You have to understand this. वो कैंसर ठीक नहीं करता है, कैंसर बनाता है, right? So this I have been telling for long. Let's say a cancer patient comes to you and you say you want to cure cancer, smoke 20 cigarettes. Will it not look funny? Like क्या अजीब बात कर रहे हैं, मुझे कैंसर ऊपर सिगरेट पीने बोल रहे हैं. तो बिल्कुल वैसा ही है कि कैंसर पेशेंट को अगर जैसे सिगरेट पीना बोलना बेवकूफी है, वैसे कैंसर पेशेंट को कीमोथेरेपी करने बोलना वो नहीं करता बेवकूफी है, उससे भी ज्यादा है. लेकिन लोग कर रहे हैं, आपके आंखों के सामने कर रहे हैं. नेक्स्ट प्लीज. तो लेट्स ट्राई टू अंडरस्टैंड. ये यहाँ पीछे विजिबल है और शैल आई पुट इट एट द टॉप, ऊपर रख लो थोड़ा सा ना इसको. Now, इसे मैं बोलता हूँ कैंसर प्रॉपर्टी. How the cancer works in your body, let's try to understand through this model. At any point of time, even at this point of time, in your body there are healthy cells and there are cancer cells also. हर पल आपके बॉडी में हेल्दी सेल भी होते हैं, कैंसर सेल भी होते हैं, अभी भी हैं. 100% of us, those who are 40 years and above, if then you do the biopsy of thyroid, all of us through the biopsy will be called as a cancer patient. 70% of in prostate, men, cancer patient. 40% of in the breast, 40% of the women in the breast, cancer patient. मतलब हमारे सबके बॉडी में कैंसर सेल हैं ही हैं. कोई भी दुनिया में ऐसा नहीं जिसके बॉडी में कैंसर सेल नहीं है. जिस तरह से हर एक के बॉडी में एचआईवी वायरस का एंटीबॉडी है, एंटीजन है ही है. But that does not mean that we are going to die of cancer. Right? In our body there are cancer cells, and that is universal for all of us. So saying through biopsy, oh, in your body we found cancer, it is nothing unusual, it is there. Now imagine, even if we all have cancer cell in our body, हम सबके बॉडी में कैंसर सेल होने के बावजूद भी हम क्यों नहीं मरेंगे उससे? क्योंकि ये कैंसर सेल मान लेते हैं, and these are normal cells, and this is the boundary. So what happens? These normal cell, it pushes the boundary and it keeps the cancer cell in restricted area, right? It restricted the movement of the cancer cell, right? Wherever the cancer cells are, they are restricted there only. Who does it? The normal cell. These cells are very, very powerful. They come and they discipline the cancer cell. So we are not going to die of cancer, even if there are cancer cells in our body, right? So ये cancer property होती रहती है. So the job of the normal cell is they keep the cancer cell in the position. वहाँ से हिलने नहीं देना, right? That's what is happening right now also. There is a fight going on between cancer cell and normal cell at every moment of our life, and all the time the normal cells are winning, the cancer cell is restricted, so we are not dying of cancer. But if you want to make the cancer cell powerful, if the cancer cell become powerful, then what will they will do? They will try to push back. They will try to push back. Right? They will try to increase their boundaries. वो अपने boundary को increase करेंगे if they become powerful. In some of the people, they give the power to the cancer cell. Then the reverse happens. They increase they push back and they try to encroach the area of the normal cell. Right? How you can give power to the cancer cells? कैसे देंगे power? You by smoking every day, by having hookah every day, lot of refined food. But the most important is, if you eat after sunset, if you eat after sunset, you are giving power to the cancer cell. अगर आप सूरज अस्त होने के बाद खाते हैं, तो cancer cell को power देगा. If you want to make the cancer cell very very strong, what you have to do? You have to eat as late as possible, midnight. This becomes very powerful. So every midnight I will have the dinner. So this cell will become very powerful. Like the people who are in night shift, right? Soldiers or emergency doctors, right? There are very very crucial professions where you have to be awake at the night. Since you are awake at the night, क्योंकि आप रात को जगो तो रात में खाओगे ना, दिन को तो सो रहे हैं आप. So they are the one who are more prone to cancer in comparison to the normal population. Normal population के comparison में उनमें cancer ज़्यादा पाया जाता है. उनकी मौत जो लोग नाइट ड्यूटी में रहते हैं, सोल्जर्स हो गए, फ्लाइट अटेंडेंट हो गए, पायलट्स हो गए, right? Why? Because when you eat after sunset, you are making the cancer cell powerful, and when you are making the cancer cell powerful, they are pushing their boundaries. They are pushing their boundaries. They are encroaching the boundary of the normal cells. That is called tumor, right? So that is how the tumor grows, and that gives you pain. The normal cell, they shout with pain, right? So these are two methods. You can have refined food, you can have gutka cigarette, or the best thing to make yourself cancer patient, every night you try to eat in the middle of the night, 1 बजे, रात के 2 बजे. Because nowadays there is a Zomato online, you can order food at any point of time. कभी भी order कर सकते हैं. Netflix में entertainment कभी भी कर सकते हैं. Work from home, in the midnight you can work. So the chances are that you can have the dinner or late night, you can indulge in eating, making the cancer more powerful. So these are the people who can become cancer patient very very fast, right? So now, how we make them more powerful? By eating late, right? So, but if you want to make it even more powerful, the next slide. Next slide. Then you look at this. When you do biopsy, when you do mammogram, when you do PET scan, you make these cancer cells even more powerful. But let me change it. When you do biopsy, when you do PET scan, when you do mammogram, you make this normal cell cancer cell, normal cell cancer cell, normal cell cancer cell. They now fight. They become the part of the cancer cell. Now they fight against your body only. They fight against your body only. They fight against your body only. Are you getting the point? How to convert the normal cell to cancer cell? Go for biopsy, go for PET scan, go for mammogram. Right? If you want that I must die of cancer, but these my cells should become my enemy, what you do? Biopsy, mammogram, PET scan. So whenever the doctor says, I want to see whether your body is having cancer or not, go for biopsy. So in reality he is saying that I want you to become a cancer patient, so go for biopsy. Whatever I just told, you can see the evidence there. Next slide. Yeah, more evidences, right? So जो मैं आपको बता रहा हूँ यही सत्य है, इसका सबूत ये रहा आपके आंखों के सामने. जब भी डॉक्टर बोले बायोप्सी कराना है, पेट स्कैन कराना है, मेमोग्राम कराना है, तो आप उसको ट्रांसलेट कीजिए. डॉक्टर ये बोल रहा है कि मैं चाहता हूं कि आपको कैंसर हो जाए, कैंसर से तड़प के मर. क्योंकि जब आप ये कराते हैं तो नॉर्मल सेल पाला बदल लेते हैं, वो कैंसर सेल बन जाते हैं. क्लियर हो गया? राइट. अब नेक्स्ट स्लाइड प्लीज. नेक्स्ट स्लाइड. ये सारे एविडेंसेस हैं. जो मैं बोल रहा हूँ उसके एविडेंसेस है. नेक्स्ट स्लाइड. नहीं, पीछे वाला स्लाइड कीजिए. बैक. ठीक है, और बैक. ठीक है, गो फॉरवर्ड. नेक्स्ट. रेडिएशन कॉजेज कैंसर. जिस प्रकार बायोप्सी से कैंसर होता है, नेक्स्ट स्टेज क्या है? डॉक्टर क्या बोलेगा? ओ, बायोप्सी से कैंसर, you have to understand. We need not to satisfy the doctor, the society, the people next door. We have to satisfy our body, ourselves. They are dying. Nobody else is dying. Right? Nobody will cry when you die. Right? सब अपने काम में मगन हो जाएंगे. आपने देखा भी है. Right? कुछ देर के लिए होता है, फिर अपने काम में लग जाते हैं. तो यहाँ एविडेंस क्या कह रहा है? The evidence says very clearly, chemotherapy, radiation, surgery, or biopsy, mammogram, these are the ingredient tools to make a normal person into a cancer patient. So most of the cancer patients, they come to us only when they have already gone through all this. Now, what is the solution? Solution is, if you can convert this normal cell again back, if you can convert this back, you can convert this and make them weaker, right, like this. How you can do it? The first step, if fever happens to cancer patient, अगर cancer patient को fever होता है, the cancer cells becomes weak, they go back to the normal size, right? So if the cancer patients suffer from fever, then the cancer cell push back, they start regressing, tumor का size कम होने लगेगा, hemoglobin बढ़ने लगेगा, energy ज़्यादा आने लगेगी, right? Then what happens? This boundary, they can start pushing back again against the cancer cell, and normal cells, they come back to their own zone, right? Fever is a solution of cancer. So now, how to cause fever in a patient? How we do it? Next slide. जो मैंने अभी बताया, what I just told you, these are the evidences, right? Whatever I am telling you, it is the mainstream evidences, right? Next slide, please. ये भी एविडेंस है. नेक्स्ट स्लाइड. राइट, तो यहाँ पे फीवर हम कैसे करते हैं, उस पे आने के लिए सबसे पहले फीवर तो जब आएगा तब आएगा, बट हाउ टू मेक द नॉर्मल सेल पावरफुल एंड हाउ टू मेक द कैंसर सेल पावरलेस, सो दैट द कैंसर सेल कैन डाई देयर ओन डेथ. It should die their own death. The tumor should regress. The first medicine which we give in our hospital, we have 20 hospitals in the name of HIMSS, right, all over the country, and now we have more than 500 clinics. लाखों की गलियों से लेकर लंदन के स्ट्रीट तक 500 क्लिनिक है हमारे. DR.BRC क्लिनिक एट द रेट होम. आप में से कुछ लोगों ने सुना है ना? आपको पता है ना, अभी हमने स्टार्ट किया. सो हम ये मानते हैं कि बड़े से बड़े दिखने वाली बीमारी का आसान से आसान इलाज घर पे ही हो सकता है. इसलिए we call it DR.BRC क्लिनिक एट द रेट होम. तो चाहे आप हिम्स हॉस्पिटल में आएंगे जहाँ लाखों रुपए की फीस लगती है, हर दिन का 20,000 रुपए लगता है, या हमारे क्लिनिक में आएंगे जहाँ पे पूरा एक महीने का 6,500 रुपए लगता है, या जो ये वीडियो भी चल रहा है, ये वीडियो पोस्ट करते हैं, जो ये वीडियो देखेगा तब घर पे करेगा तब भी वो ठीक हो जाएगा, क्योंकि यही चीज हम हॉस्पिटल में करते रहते हैं. द सेम थिंग वी आस्क टू डू इट when they come to a clinic, and same thing patient can do on their own even without our supervision by listening to watching this video. इस वीडियो को देखने से भी उतना ही ठीक होगा. तो पहली चीज जो हम करते हैं, we have our center in Malaysia, in Vietnam, in Hanoi, in Ho Chi Minh, right? In as many as 10 countries, including UK, Pakistan, सब जगह, नेपाल, हर जगह हमारे सेंटर. So in all our center, the first medicine we give to the patient is, all kind of patient, time as medicine. The most powerful medicine on earth, time as medicine. So whenever any patient comes to you next time, whatever may be the illness, physical or mental, the first medicine you have to give is a time as medicine. What is this medicine? Next please. Time as medicine में, you can see it here. What we do, we ask the patient, don't eat anything before 8 a.m. Don't eat anything after 6 p.m. सुबह 8 बजे से पहले कुछ नहीं खाना, रात के 6 शाम के 6 बजे बाद कुछ नहीं खाना. Eat within the bracket of 10 hours. and fast for how many hours? Right? 14 hours. जैसे ही आप ये करेंगे, you have to remember one very important thing. The cancer cells are fed, they eat only after the sunset. But you are not giving any food to the cancer patient because you finish your dinner before 6 p.m. The moment you start doing it, we have seen consistently in our hospital, within the first week to 10 days, constipation reduces, acidity reduces, bloating reduces, sleep increases. But if you continue to do it for second week, by the end of second week, joint pain would increase, the joint pain reduces. But if you continue to do it for 3 weeks, by the end of 3 weeks, blood sugar, blood pressure वो नीचे आने लगता है. सिर्फ एक बदलाव से. But if you continue to do it for 4 weeks, gastric, esophageal reflux disease, weight, जो मोटे लोग हैं, वो कम होने लगता है. Means every week you see changes in your body. Every week, by giving one medicine, time as medicine. For cancer, what happens? When you don't eat after sunset, but body needs nutrition, so body what they do? They break the tumor cells. You take of nutrition. Tumor consists of all kind of vitamin, mineral, carbohydrate, protein, fat. Tumor is a storehouse of good minerals. Tumor is not a bad thing. It is only at the bad place. So when you don't eat after 6 p.m. and when you fast for 14 hours, body क्या करता है? It breaks the tumor, takes the nutrient and supply to the body. This means you are getting rid of the tumor. Tumor से आप कुछ कर रहे हो? Body gets the nutrition. When you do it every single day, don't eat after 6 p.m. Your tumor it reduces, your pain reduces, weakness reduces, and you start improving. That is the first important medicine which we give. In our hospital, the kitchen closes at 6 p.m. Finish. अगर तब तक नहीं खाया तो कल ही खाओ. तो भूख लगी क्या करेंगे? अरे आपकी बॉडी में ट्यूमर है ना, बॉडी तोड़ेगा उसको, खाए खिलाएगा आपके बॉडी को. I need not to worry about it. Give a chance to the body to break those tumors, break those stones, break those blockages. ये ट्यूमर, ये ब्लॉकेज, ये स्टोन, पॉलिप, फिशर्स, यही सारे तो बीमारियां हैं. But they are the storehouse. They are the good nutrition. This is called autophagy. नाम सुना आपने autophagy? It got 3 Nobel Prize, right? तो ये साइंस है. Time as medicine. The first medicine we give the time as medicine, but if we want to make it very fast, we give the second medicine, food as medicine. Next slide please. Next slide. Food as medicine. In food as medicine, आप में से कितने लोगों ने आज से पहले DIP diet सुना होगा? Most of you heard of it, right? It is more than 12 years I have been prescribing and propagating DIP diet. So 8 a.m. to 6 p.m. be on DIP diet. जब ऐसा कर देते हैं तो speed of recovery become faster. कितना fast? Next slide. Within 72 hours, for most of the people, their blood sugar reduces to the level कि इंसुलिन छोड़ना जरूरी होता है, दवाइयाँ छोड़नी जरूरी हो जाती है. 3 दिन से 1 हफ्ते के बीच में blood pressure reduces, cholesterol reduces, intestinal disorder vanishes. If you can do it for 1 month, 10% body weight reduced for the fat people, heart disease vanishes. Means angina goes away, pain goes away. If you can do it for 2 months, thyroid disease vanishes for most of the people. If you can do it for 6 months, all the symptoms of cancer vanishes. Tumor, weakness, pain, right? Asthma, the inhaler, the people don't need, right? Arthritis, all kind of things are vanished. If you can do it for 8 months, kidney dysfunction, liver disorder, skin disease starts disappearing, right? 3 months, glaucoma, cataract, myopia, spectacles. Here also many people are wearing spectacles. If you want to get rid of spectacles, do it for 3 months. 3 महीना करेंगे, then it will be difficult to wear this spectacle because your body eyes will not need it. So only without spectacle you will be able to see clearly, right? So genetic disease up to 1 year we see benefit in genetic disease also. So here 2 medicine I prescribe, time as medicine and food as medicine. When you combine both of them, then you see the wonder. So for those who are new, what is DIP diet? Next slide. In DIP diet, step 1, Till 12 noon, be only on fruits, 8 a.m. to 12 noon. How much fruits? 3 to 4 kind of fruits, or even one. Your body weight into 10. My body weight is 70 kg into 10, that becomes 700 grams. 700 grams of 3 to 4 kind of fruits till 12 noon. Nothing else. At least this much. For example, today, before coming to this lecture, what was my breakfast upstairs? 1 dozen केले खाती हो गए breakfast. 1 dozen बना, 1 dozen. अभी तो और खा रहा था. विनोद जी ने बोला आई जल्दी आइए अपना क्लास शुरू होने वाला है. तो अभी छूट गया लेकिन 1 dozen खा लिया अभी. ठीक है? So easy to have breakfast as fruit. You need not to cook anything. For banana you need not to wash also. Just peel and eat. Right? And it is economical also. Right? So step 1. Step 2. When you sit for lunch and when you sit for dinner, have 2 plates, plate 2 and plate 1. Plate 2 you eat all kind of food, whatever you've been eating. It can be noodles, it can be rice, it can be bread, roti, whatever. But before you start eating it, first you finish plate 1. Plate 1 means 3 to 4 kind of vegetables in raw form. Tomato, cucumber, radish, carrot, there are many vegetables which one can eat raw into 5. My body weight is 70 to 5, that becomes 350 grams. So this is 350 grams of medicine. We all eat vegetables in raw, but when you eat in this quantity, it becomes medicine. When you eat vegetables in this quantity, your body produces enough nitric oxide, and that is a cleansing agent. It cleans the body. Then you eat this. Right? Lunch, first I eat this, then I eat this. Dinner before 6 p.m., first I eat this, then I eat this. I am not reducing your food, I am increasing the food. Final, third step. Don't eat any animal food and dairy products. Don't eat any fat food. Right? So it is very hard for some people, right? Those who have been non-vegetarian. But when you reduce eating this, you see the improvement very quickly. और क्या लेना है? Sprouts, nuts, maybe a multiple, plenty of fruits, lot of sunshine. This is called the diet. So this is food as medicine. And the third, the most important medicine, next slide, zero cold medicine. Zero cold. Aapki immunity, the immunity of your body is strongest when your voltage is zero. This is the electrical equipment, this is the electrical equipment, this light is electrical equipment, they have their own voltage. Similarly, your body is also electrical equipment, you also have a voltage. हमारे body की voltage कितनी है? इस वक्त अगर voltmeter होता तो measure करके देखते, we all have some voltage like this, right? Whenever we will have a voltage, our immunity will not work perfectly. हमारी voltage शून्य कब होती है? Anybody knows? जब आप धरती को टच करते हैं. The voltage of the earth is zero. When you touch the earth directly, your voltage becomes zero. When your voltage is zero, your immunity is at the peak. And when your immunity is at the peak, the disease vanishes very fast. How fast? The next slide. If you do this, after this you go out, not on the concrete, but where there is earth. Even in the river. When you enter the river, what will happen? Within 10 seconds, your voltage will become zero. You can check it through voltmeter. If you can remain there for 20 minutes, your mood and stress, mood will improve, stress will reduce. But if you keep staying there for 45 minutes, heart palpitation goes away. But if you keep staying there for 1 hour, all kind of pain relief starts. Knee pain, joint pain, it starts vanishing. It starts vanishing. But if you can do it for 1 to 2 hours every day, better sleep every night. And if you can do it for overnight, how we do? We cannot stand outside overnight, but take a conductive wire, a tar le lo, like these wires. One end you touch, connect to the body, other end you dig outside in the earth. जैसे अर्थिंग करते हैं. आप हमारे हॉस्पिटल में आइए, आप देखेंगे हर पेशेंट के साथ एक तार वो जमीन पे खड़ा है. If you come to our hospital, you will see that every room, every patient is connected through wire. The wire which goes out through the window and It digs inside the earth. So overnight they are sleeping, but they are connected with the earth. So तो जो गैंग्रीन के पेशेंट होते हैं, गैंग्रीन या इंजरी या जिनमें पस निकलता है, कैंसर के पेशेंट्स, they start getting recovering very fast because the immunity is very strong. If you can do it for 7 days, every day about 1 hour, by doing only this one thing, you can reduce the blood sugar, blood pressure, right? So this is what is called zero cold. Humans are the only animal who are dissociated from earth. Rest all the animals, they are always connected with earth. Among the human, only the beggars, those they don't have home, those who don't have even sleeper, they are also connected with the earth. You see, we all, including me, we are wearing a coat even when we feel cold, we are suffering from some fever. But the beggars, जो भिखारी हैं, आप सोचिए उनके पास तो कपड़े भी नहीं है, घर भी नहीं है, वो तो नहीं मरते, आप मिलके देखिए उनसे. Why? Because they are connected with the earth, right? So the earth is protecting them, right? Think of a small baby, an infant. छोटा बच्चा कई बार चिल्लाता है, रोता है. Small baby in a very distressful mood, shouting and crying. Nobody is able to calm the baby. But when the baby comes in the lap of the mother, माँ की गोद में आते ही क्या होता है? शांत हो जाता है, माँ कुछ नहीं करती. Similarly, when you come to the lap of the Mother Earth, your pain and mental and physical goes away. So it is a science. It is science. And if you want to know more about the science, previous. No, it's not. You can read this book, Cure of the Red Zero Book. I have given all the evidences. We do it in our hospital, right? We know the people, if I can influence the person so that they touch the earth every day, that will help to recover from the illness. Simple. Earth as medicine, zero medicine. It is free, it is invisible, but it is most powerful. Free, invisible, but most powerful. Available everywhere, for everybody. When a bird is sitting on the tree is connected to the earth. So the bird is also getting connected to the earth. Right? But human being, they are getting disconnected, right? More away from the earth. So we are more safe, right? पीछे. और पीछे. The last is emergency medicine. If the person having heart attack, then emergency medicine, heated medicine, works very fast. If a person is having weakness, person is in pain, person having lot of swelling, person will become unconscious. A person's blood pressure shoots high, I want to reduce it now. Then the emergency medicine is healing. This is my book, you can download from my website, vishnu.com/ebook. You will find this book where every evidence is there, but I will share how to do it, vishnu.com/ebook. All my books you can get it free from here. But I will share with you हम कैसे use करते हैं, how we use it. Emergency medicine. Now you recall, come back here, that these are the cancer cells, right? And if you want to discipline them, अगर आप चाहते हैं कि इनका एरिया दोबारा वापस आ जाए, right? And if you want to make the normal cells powerful against them, so one fastest way is you give fever to the body, right? अगर उनको fever आ जाए, तो ये powerless होने लगेंगे. These will become powerless, the cancer cells, and normal cells will become more powerful. How we can give fever to the cancer patient? The next slide. This is how we do give fever to the normal every patient. Take a bucket, step 1. Step 2, put water temperature 42 degrees Celsius, very hot, and let the patient sit and put both the legs in the bucket for 30 minutes. When you do this, जब आप ये करेंगे, बॉडी का टेम्परेचर क्या होगा? ऊपर जाएगा कि नीचे जाएगा? Initially ऊपर जाएगा, because you are giving heat, your body temperature will increase. जब किसी को फीवर होता है, बुखार होता है, तो और नॉर्मली आता है. So for reducing the blood pressure, for curing the infection through fever control, for resolving the angina, and for giving relief from the pain and fatigue and weakness. This is called lower leg hot water immersion, LLHW. That's what we call it, right? So anytime in emergency situation you feel patient's blood pressure has increased, or in a fever he is becoming uncomfortable. But fever is not our enemy, so we support the body by giving additional fever so that the body can solve the problem why the fever came. Right? So this, when you do it at the time for cancer patients, when you do this, while he is doing it, the body temperature will increase by artificial fever to the cancer patient. And when you are giving artificial to the cancer patients, this cancer cells will become powerless again. This cancer cells will become powerless again, and this normal cell will become powerful again. Right? So every single day, 2 times a day, we say the cancer patient do this. In hospital we do it, they can do it at their home, but you can see the result. How you know the patient is recovering? Through the symptom only, not through the biopsy. If the weakness reduces, if the pain reduces, if the hemoglobin increases, if the weight increases again, patient is recovering. Right? Need not to check by biopsy, need not to check by PET scan, need not to check by mammograms, because those are not diagnostics. In the name of diagnostic, they are giving cancer. So how we know the cancer is there or not? How I recognize the cancer patient? मैं कैसे cancer patient को पहचानता हूँ? Whenever a patient comes to me and say I am a cancer patient, I look for 4 things to find out whether there is a cancer patient or not. Number 1, extreme weakness. Number 2, extreme pain. Number 3, hemoglobin drops by drastically within 1 month. Number 4, body weight drastically drops 10 kg in 1 month. For example, if these 4 conditions happens, he is a true cancer patient. Not because of the biopsy, but because through the biopsy, these 2. So what should be our aim? Our aim should be to relieve in these symptoms. Weakness, if it vanishes, pain if vanishes, hemoglobin raises, weight raises, he recovered. That means he recovered. Right? So keep the definition of cancer like this, simple. Patient says, how I know I have a cancer? I say, you just check whether you are having these 4 or not. If not, you are not a cancer patient. If yes, then you are a cancer patient. Don't worry. Take these 3 medicines. Time as medicine, food as medicine, 0 volt medicine, in addition to that, heat as medicine. When you do this, now you check whether my hemoglobin is increasing. Oh, I am recovering from cancer. My weight is increasing. I am recovering from cancer. My weakness is going away. I am recovering from cancer. My pain is going away. I am recovering from cancer. Make it simple. Right? So heat as medicine, we give it to our patients for not only cancer, for not only other discomforts, but also for chronic kidney disease. If the patient is on dialysis, and if the patient wants to recover, if the doctor said that you need a kidney transplant, or patient already going for dialysis, अगर dialysis पे है transplant के लिए बोल दिया, if they come to us, what I do, I put the patient in a bathtub. Next slide. गर्म पानी के टब में 40 degree temperature, patient inside the bathtub, the water level is this. If you do it for 2 hours, so you are giving fever to the body for 2 hours. So after 2 hours, when the patient comes out of the tub, blood pressure reduced, weakness reduced, body weight reduced by 500 grams to 1 kg. The excess fluid deposit goes away. Right? So when you do it every day, he will not need dialysis anymore. Right? The most important. He will not need blood pressure medicines, and he starts recovering from cancer, from chronic kidney disease. This is my hospital in Jaipur, as you can see, right? And these are the real patients. This is another hospital in Jodhpur, right? These are the real true patients, right? And at that time they were needing dialysis, but now no more dialysis. Why? Because when you do this, your skin becomes the 3rd kidney. You have two kidney here, but skin is on third kidney. How to make the skin as a kidney? Give it fever, number one, and give it pressure, water pressure. When these two things you give, your skin acts as a kidney. Okay, you can test. You take a sample of urine and you take a sample of sweat. पसीने का बूंद ले लो and पेशाब का बूंद ले लो. Go for lab test. You'll be surprised. Both of them are having equivalent nutrient inside. पेशाब में भी, urine में भी you'll find creatinine, urea, uric acid, sugar, protein, magnesium, sodium, and all these things you'll find in the sweat also. So sweat is to the skin and urine is to the kidney. So your sweat and urine is having the same purpose. So your skin is the third kidney. When both the kidney fails, activate the third kidney. And when you activate the third kidney, the rest of the two kidneys gets a chance to recover and they recover. And then you need not do it anymore. So these things people do in my hospital and they recover from dialysis. They recover from kidney disease. But my hospital is expensive. So many people, they watch this video, these kind of video they do at their home. Many people they do at their home and they also recover. Then they come to us, come to me in some conference. Sir, I saw that video, I was a dialysis patient, I got cured. I said, which hospital you were admitted? In which of my... They said, no, I did not come to a hospital, I did it in my home. Then I asked, how you did it at home? Then they start sending the videos. So next slide, how they do it in their home. Next. तो घर पे कैसे करते हैं? जुगाड़ से, right? So if you say it is expensive, no, it is not expensive, right? So hot water and taking the industrial drum, sitting inside the drum will also solve the purpose similarly, right? Taking a fridge, take out the door, sit inside it. They were a kidney patient once upon a time. Now you see the bathroom, he made a wall and now he used as a hot water tub, right? And hot water already coming from the tap. He is an engineer, he made a portable hot water tub, having all the system, including the thermostat, including the heating machine. He is showing it inside, portable, you can just carry it anywhere, right? So now, whatever I have shown you, these things, if you want to see the evidences, you must read these two books, End of Transplant and 360 Postural Medicine, right? And you will find all the evidences, how we do it, and you all can do it at your home. You can, even the people who are not educated much, illiterate, they all can do it. They are doing it only, right? These are very simple knowledge, very close to the nature, and these are the real medicine, right? And these are having no side effect, only side benefit, right? So many people, by using time as medicine and food as medicine, only these two medicines, they are able to recover their diabetes, hypertension, heart disease, all these kind of disease. Only when you are in a trap of a doctor, then starts the actual disease. You have to understand that, and you have to make the people understand. And to make the people understand, we have to be in plenty of numbers, trying to educate people, right? So that the knowledge should spread, right? So what we have done in the past, and I want you to get connected with us. Next slide, please. Next slide. So we have started DR.BRC clinic at the Red Home, and more than 500 clinic now. And in those clinics, the people like you, we train you, and then together we become partner in helping the patient recover at their home, right? So if you want to join with me, so to help the people, so you go to vishru.com/clinic and you fill a form, and then my team will connect, or this is our phone number. You fill the phone number, leave a WhatsApp message, and my team will contact. So this is the way a person can get healed at home, in hospital, anywhere in the world. Because time as medicine, you can do it any point of time, anywhere. Food available everywhere. Earth, 0 volt, everywhere. Heat, everywhere. These things cannot be packed in a bottle. These things cannot be patented. These things cannot be converted into full-fledged industry or business. So even if these are the only thing which can help a person recover, these are not propagated. So I am thankful to Dr. Vinod Kashyap. He created a platform where we can propagate the real science, right? So I hope more and more of you will join together to spread the real science so that we can reduce the pain in the humanity to whatever extent we can. So before you leave, I am leaving some books for you, and in this books you will get lot of other information which I could not share because of limitation of time, right? But you will get many more. This book we released last month, 23rd of January 2025, and HMTV. Do you remember few months, few years back there was one again a scare, monkeypox. याद है आपको? Monkeypox आ गया, right? So again the same question, lockdown हो जाएगा. तब हमने तब भी ऐसे ही किया था. Monkeypox, pandemic launch. तब भी exactly same. इस बार हमारा जो एडिटोरियल टीम उसको बोला जहाँ जहाँ monkeypox लिखा उसको काट के HMPV कर दो. तो HMPV का बुक बन गया. और अगली बार के लिए कुछ ना कुछ तो आएगा ही, तब वो कर देना. सिर्फ वो एक बार टेस्ट करना, वो वीडियो जो बनाया था टेस्ट करने का, वो नया है, राइट? बाकी सब वो होता है ना, पोस्टर वो नया आ जाता है, कहानी पुरानी ही होती है फिल्मों की, राइट? तो वही वाला हाल है इनका. सो ये समझाना पड़ेगा लोगों को, ताकि लोग इस डर के खेल के बाहर निकल पाए. और यही आप और हम मिलकर कर सकते हैं. ओनली वी कैन डू इट, राइट? तभी हम यहाँ पे सारे काम छोड़ के, आप यहाँ पे हैं, मैं यहाँ पे हूँ, राइट? तो इसका पर्पस है कि लोग पहले तो हम खुद इसको अमल करें, क्योंकि घर ही रहें, फिर लोगों को भी इसको करें, राइट? तो मैं ये नहीं बोलता हूँ कि मैं बीमार नहीं पड़ूंगा, बीमार पड़ता हूँ, लेकिन मैं जानता हूँ कि बीमार पड़ गया तो मैं ठीक भी हो सकता हूँ अपने आप, राइट? आई हैव द पावर टू क्योर माई सेल्फ. और अगर मैं अपने आप को ठीक नहीं कर सकता तो दुनिया में कोई भी नहीं कर सकता, राइट? सो आई एम सेटिस्फाइड एंड हैप्पी दैट आई कैन क्योर माई सेल्फ. इफ नॉट मी देन नोबडी एल्स, राइट? So that confidence we should give to people. You have to become your own doctor. Thank you. Thank you. No. Yes. Yes.
Tất cả việc chập ttất cả việc